Some healthcare facilities in our area say they are seeing more cases of early onset dementia than ever before. Some patients are even being diagnosed as early as in their 40s. CBSN New York's Lisa Rozner reports.
I think it was...
Whoa. Was it a turkey sandwich?
Chicken.
Rita Benezra Obeder, a former pediatrician, was diagnosed several years ago at the age of 59 with a rare form of dementia.
She doesn't remember what happened, minutes ago.
Husband Robert Obeder left his job 2 years ago to care for her. She attends Christian Healthcare Adult Day Services in Wyckoff and aides help at home at night. The couple has 3 adult children they raised in Ridgewood.
They'll have the same conversation with her every time they speak to her, in fact, several times.
Dementia is an umbrella term for diseases characterized by a decline in memory, language, and other thinking skills needed to perform everyday activities. Alzheimer's is the most common. The National Institute of Health says there's around 200,000 Americans in their 40s, 50s, and early 60s with early onset Alzheimer's. That's 5 to 10% of people with Alzheimer's. Administrators at Harmony Village, an assisted living facility in Paramus for people with dementia, say they're seeing an influx.
Last weekend, I met with a family whose brother was 45. We have a resident here who's 56. He has 3 teenage children at home and a wife.
Sometimes he doesn't remember his kids.
Correct.
Yeah.
Which is hard for the children.
Was always daddy's girl, and she can't come and visit dad. She finds it too emotionally draining. It's very emotional. I myself find that you have to give 1,000%, not only to the resident that's living here, but to all the family members.
The wife prompted the center to spearhead a free bi-monthly support group for spouses of those with early onset dementia. She asked us to conceal her identity because coworkers and friends do not know.
The person is still there, but the person you married is not there anymore. And every time you visit and every week, he's losing another ability. So it's mourning 1,000 deaths. It's a mourning that never ends.
It's like something out of movies, such as 50 First Dates.
Yesterday, I've never even met you.
And Still Alice, where Julianne Moore's character is diagnosed with Alzheimer's at 50.
I have Alzheimer's disease, early onset. Oh my God.
Dr. Manisha Parulakar, a geriatrician at Hackensack University Medical Center, says she believes movies like these and less of a stigma surrounding the disease are contributing to a rise in referrals, but there's not enough studies to confirm a rise in cases. It was the subject of a recent conference.
They were talking about, is there a rise in early dementia because of the processed food or the fertilizers or the other environmental hazards. So there are definitely some genes that are more associated with Alzheimer's especially, and we actually see that more with the early onset.
Is it treatable?
Most of our treatments that we have, they could help us slow down the progression. We cannot really cure anybody. There are some studies which are showing that Mediterranean diet can be neuroprotective, doing cognitive exercises.
She suggests exercises like crossword puzzles and Sudoku. At Rita's Day Center, the CEO says the focus is on mingling.
By socializing and interacting with others, we can help to retain those portions of the memory as long as possible.
While no one can predict the future of their health, there are ways financially that families can prepare.
It gets very expensive. It could be $150,000 a year or more.
Husband-wife lawyers Yale and Lori Houtman say they're seeing more clients with this problem and recommend considering purchasing long-term care insurance starting at the age of 40.
It can pay for an aide to come into your home. It can pay for the cost of assisted living. Health insurance doesn't cover long-term care. Medicare doesn't cover long-term care.
Everyone over the age of 18 needs a power of attorney, a health one, a health care power of attorney, and a financial one.
But even with the insurance, the mom we spoke with says she could be in trouble.
It has a monetary cap that may carry you for 3-4 years, and after that you have to pay out of pocket. Now I'm the sole provider for them, for my kids, and taking care of my husband as well. So everything is on me.
Meantime, as the disease progresses,
Hi, Rita.
Hey, guys.
the family say one thing that their spouses remember is how they made them feel.
I think he still remembers how I make him feel. And so when I get there, he's happy for the most part. And that, makes my day.
A love the Obeaters will hold on to for as long as they can.
So he proposed after I asked him.
She forced my hand. We've been married 43 and a half years.
And Lisa Rozner is here right now, and those are heartfelt stories and realities, and we never know who is going to get dementia, Alzheimer's, including each other here. The family members are so deeply affected. What can help them through this?
Well, the one facility that was highlighted in the piece, which is Care One Harmony Village, actually has tailored its approach so that when families come and visit, for instance, the one woman who was anonymous, when her teenage children come and visit their father, they want to make it as normal as possible. So they will have them sit in their movie theater that they have there and watch Netflix. They have a pinball machine. They have games. They have popcorn. So they really want to make it feel like they're in their own home enjoying their time together.
And also because we saw the partners here understanding what they're going through, but especially if patients, you get some in their 50s and 40s, and then their children are going to be really young, and just understanding it is so difficult for little kids.
Yes, processing it. I mean, some of the children have needed some therapy because it is very hard to, for instance, like the one girl, she's daddy's girl, but now daddy doesn't even know who she is. So that's been really difficult for her to process.
Then there's the financial part of it. The people you interviewing talking about long-term care and realizing that early on in your work life or in your life, how important that is.
Yeah, well, someone pointed out also that the younger generations are not really savers. So as we see more cases of dementia, or when people want to be protective, it's harder if you don't save. And that's a characteristic that the younger generations haven't really adopted. So there could be a real crisis. Right now, as the doctor said in the piece, we've really only seen a rise in referrals and not cases. But if things change, I mean, people that aren't saving won't be prepared.
What surprised you? Everything surprised me about this story. So done so well. What about you going through it all and all the people?
Well, I think the fact that dementia really does not discriminate. You saw Rita Obeater in the piece. She's a former pediatrician. The other gentleman who we didn't show out of respect for the family, he used to be a journalist, just like you and I. So, and it's all backgrounds, all ethnicities, and like it was said in the piece also, someone as young as 42. So that's really scary that we don't know a lot about how this is happening.
Or how we can prevent it. I mean, is that truly the right word to even use? What can we do to help ourselves?
Right.
I mean, healthy.
Right. So the doctor said really right now all that's being recommended is possibly Mediterranean diet or cognitive exercises. She did say early diagnosis is key. So even in your 40s, if you notice that you're forgetting routines, recipes that you've known your entire life, and it keeps happening, it's not a bad idea to see a geriatrician or a neurologist. And there's not one test that diagnoses dementia. There's a number of factors they look at, but they can run a brain scan. That's part of it. There's MRIs, CAT scans, as well as other tests that they'll look at. It's a whole picture.
Great advice. You wanted to talk more about Harmony Village before we leave here, the support group, free support group.
Yes. So the loved ones of these patients, they wanted a group where they can relate to one another because they still have a lot of their life ahead of them and their children. So this is a free support group open to the public at Harmony Village twice a month, and we have that information online.
In Paramus. All right. Lisa Rozner, thank you so much for this important information. As she said, we have more online, so make sure you check it out to learn more about symptoms of the disease and also how to get help.